HPV is a DNA virus that affects the epithelium, also known as the skin. HPV can cause warts, but also it can cause cervical cancer. There are more than 100 types of HPV strands. Different types of HPV can cause warts on different parts of the body. Some HPV can cause cancer. So the signs and symptoms of HPV are genital warts. Genital warts on females can be found on the vulva, the cervix, around the anus, and within the vagina. For males, it can be found around the penis, scrotum, and around the anus. Another type would be common warts, and these warts can be found around the fingernails, the fingers, and the hands. Plantar warts can be found on the bottom of the feet or around the heels. Flat warts can be found around the face, neck, hands, wrists, elbows, and knees. And also the last one is cervical cancer. The highest rates of HPV are in sexually active young adults. It is the most common STI in the United States. There are approximately 20 million reported cases of HPV, and there are 6.2 million new cases each year. Genital warts occur most often among young adults and adolescents. Common warts occur most often in children and adolescents. It is more often that women have HPV than men, and no ethnicity has a greater risk of developing HPV.
Moving on to risk factors, having an increased number of sexual partners increases your risk to contract an HPV infection. Also, having sex with a partner who has had multiple sex partners also increases your risk. Another risk factor is your age. Common warts occur most often in children and adolescents, and genital warts occur most often in adolescents and young adults. Having a weakened immune system also is a risk factor, and immune systems weakened by HIV or AIDS or immune suppressing drugs after an organ transplant can increase your risk. Damaged skin is another risk factor. Areas of skin punctured or open are more prone to common warts. An example of this is biting your nails, and you can see that warts will develop around your fingernails. And lastly, personal contact. Touching someone's warts or not wearing protection before contracting these surfaces or exposed to HPV can increase your risk. An example of this is public showers or swimming pools. Moving on to prevention. You can prevent common warts by preventing the spread of infection and formation of new warts by not picking at your wart and not biting your nails. You can prevent plantar warts by keeping your feet clean and dry, wearing clean socks, and wearing shoes or sandals in public pools and locker rooms. And lastly, you can prevent genital warts by having a mutual monogamous sexual relationship, reducing the number of sexual partners, and making sure to use a latex condom. Also, women should have regular pelvic exams and Pap tests, and this will look for abnormal changes in the cervix that might be precancer. Also, it is important to get vaccinated with the HPV vaccine, Gardasil and Cervarix, and these vaccines are actually most effective if they're given before becoming sexually active. And these are approved for girls and women aged 9 to 26, and it protects against the development of cervical cancer and genital warts. And these are also approved for boys and men aged 9 to 26 to protect against genital warts. Lastly, to detect HPV, there are actually no blood tests. You can, however, visually inspect the warts or lesions, and your healthcare provider can detect the infection with a Pap test, and this will actually gather a sample of cells that are removed from the cervix to detect it. You can have a vinegar solution test where the vinegar solution is placed on the cervix, and the solution turns the abnormal cells infected with HPV white. And lastly, you can have a HPV DNA test. And this looks directly for the genetic material of HPV within the sample of cells.
For treatment of HPV, you first want to start out by diagnosing the fact that you have HPV. So you can either use a colposcopy, an acetic acid application, which happens to be a non-specific method of diagnosing HPV, or you can use the reliable HPV DNA lab test, which can identify many of the several strains of HPV. Now, in most cases, you're going to be dealing with subclinical HPV, and that usually clears spontaneously. As a result, the use of specific antiviral therapy is not recommended, but you can treat the manifestations that follow, including macroscopic warts, which can be an issue with self-image, or pathologic lesions that are found in the cervix, which happen to be cancerous. And treatment can also be directed towards any burning, fissures, or pain during intercourse. Now, there are several dimensions of health that are affected by HPV. HPV is among the common viral infections that account for $15.9 billion annually. Now, this does not include all the cases that have not been accounted for or reported in hospitals, so this number could potentially rise in the future. On an emotional standpoint, HPV can cause a woman to become infertile. Now, this is a severe hindrance on any young woman that would want to start and raise a family. And as with other STDs, people with HPV may carry a social stigma. Most commonly, other people who see people with STDs are seen as promiscuous.
The next step would be to find support services for you who is affected or a loved one that's affected. One of the most important things is developing a support system, which can include friends, family, other loved ones that you want to include for your support. If you have a limited support system or you wish to expand your support system, these are a couple options that you can go to. They're online services that help women who are affected by the virus or just want to learn more about the virus itself. The first one is Healthy Women, and it's the nation's leading independent health information source for women. Their mission is to educate, inform, and empower women to make smart, health, and healthier choices for themselves and their families. Through this website, what's unique about it is it can link you to other services or other websites, facilities, doctors. You can talk online with medical experts or just get in touch with other people that are affected by HPV. The second one is dailystrength.org, and what's really neat about this this online service is just it's just solely a support blog where you can just talk to women that have been affected by HPV and see how they're dealing with it, or just encourage each other. I know talking to family members who are not affected, is a good way to help yourself, but they don't understand since they don't have it. But this is a good option for you to use to talk to other people who have been affected by it. The third one is the HPV Support Network, and it's a non-profit organization, and it's dedicated to providing accurate information about HPV for women, men, and just healthcare providers who want to know more about the virus. And they're really big on, it's not only about cancer. So a lot of people have myths about if you have HPV, you're going to have cancer. But there is a link between those two. But it's also another great resource, and you can also talk to other people who've been affected by HPV. Lastly is rehabilitation goal and services. What you want to do, the goal is, ultimately, is know what you have. That's the first step. What is it? And from other previous slides, it does go into, signs and symptoms, what it is, but you just want to fully understand what you have, and then the secondly would be to decrease the spread of the virus. You want to have a good understanding how it's transmitted. You want to inform your partner that you were diagnosed with HPV, and that you be honest with them, and that they should go in also to get tested. If you have multiple partners or have had a history of HPV, you want to make sure you use latex condoms to decrease the spread of the virus. Then lastly would be, which is also an important factor, the women should be informed the link between HPV and cervical cancer. Just because you have HPV, it's not guaranteed that you will have cancer, but it is, the chances are increased. So what we recommend is being aware that there is a link between those, and also having close follow-up care with your healthcare provider, and having annual checks, examinations, cervical examinations, and screening for cervical cancer. Women should also have regular pap smears. You want to just be aware, you know, the earlier detected, the better. And this just makes it a whole lot better in dealing with HPV. So hopefully from all the slides, you've understood what HPV is, and taken this information for yourself or for other loved ones.